Hi, everyone. My name is Dr. Diana Zitzerman, and I am a licensed acupuncturist here at the JCC, Mandel JCC, and I am very excited to be presenting acupuncture for what ails you. Hopefully you get a lot out of this presentation, a little bit more about this type of background in complementary and alternative medicine, as this is a wonderful source of mind and body healing. And if you haven't yet tried it, I suggest to try it, but first learn a little bit more about it. So acupuncture is a form of traditional Chinese medicine, and it's pretty ancient medicine because it dates back to over 2,500 years. The practice in of itself is an adjunctive, so it's the acupuncture needling in and of itself, but it also can be coupled with herbal therapy, qigong, tai chi, diet therapy, and other types of therapies, including cupping, gua sha, Tui Na massage, and moxibustion. The idea of using acupuncture needling or traditional Chinese medicine is to treat the whole person, meaning the mind and body, because there is a lot of connection towards mind and body medicine. And this is all based on an underlying constitution. If we treat the whole person based on the underlying constitution, we can hopefully help to prevent disease and definitely promote balance and harmony in the body. Now, Chinese medicine can be very complex because it uses various types of systems, of theories. And today I'm going to explain to you a little bit about the Yin and Yang Theory, the 5-element, and the Zong Fu organ pattern diagnoses. So what can acupuncture treat? A myriad of symptoms and illnesses. They could be from pain, like back pain and shoulder pain, knee pain, hip pain, joint pain, any pain. Also sciatica. A lot of times it can actually help to improve sleep disturbances or insomnia. It can definitely also help to calm the mind and reduce stress in the body and the mind. It can also combat various mood disorders like anxiety and depression. It can also be very helpful in digestive issues, whether you have irritable bowel syndrome, irritable bowel disease, whether you suffer from any kind of nausea, vomiting, diarrhea, constipation, or a mixture of the two. It's also been used in infertility treatments, whether you're male or female. And when it comes to women's health, it can help to regulate your menstrual cycle or even deal with symptoms of menopause. And of course, with the now in time of viral infections and boosting immunity, it can also help with COVID long haul symptoms, whether they're related to brain fog or fatigue, pain, joint pain, or any other types of symptoms that can be causing these long haul symptoms. So what are the benefits of acupuncture? Well, you may experience, while you're being needled, deep sense of relaxation. But afterwards, you might have improved sleep, improved stress response. That will be great for your adrenals. Also less pain. Maybe you might be also suffering from neuropathy. You may also experience some increased moods, stable moods, and definitely energy. Why not worth a try, right? So I always get the question, how does acupuncture work? And there's a lot of literature trying to decipher the mechanisms behind why this is working. So essentially, if you've ever seen an acupuncture needle or been acupuncture needled, a very thin needle gets pierced through the skin. And it only goes a couple centimeters or maybe up to an inch in depth. So it's very minimal invasiveness. However, what you start to experience maybe is a sense of sensation, or maybe you might not experience anything in the beginning. But the idea is that there's a signal stimulus, and as the needle pierces through the skin, it goes into a specific point called an acupuncture point. And these acupuncture points are between connective tissue, between the blood vessels and the nerves, and the lymph vessels. So specific meridians or channels along the body from head to toe that can start the movement of qi. We'll discuss this in a little bit. So when you have this acupuncture needle insertion, it stimulates a local centralized response. From this localized reaction that's happening at the sensory neurons in the skin, they're starting to stimulate. And then they feed back into the spinal column and then the brain, where it integrates the signal of possible pain, and it sends a descending response through the similar tracts of the nervous system, and it can produce a sense of relief. This is typically how pain modulation is occurring through the use of acupuncture. So it can reduce pain by activating specific areas called acupuncture points, as we've talked about. And what you actually may feel with an acupuncture being activated, the needle site being activated, is a sense of soreness, deep achiness, a fullness. Sometimes people describe it as a heaviness, like you're planted to the table. And that's actually a positive response. It's called the qi. And that's what a clinician like myself or patient may feel. But what's actually happening at the site? Some literature has actually been able to identify certain key chemical reactions that are happening at the skin site, but also some molecular changes that are occurring within the neurons themselves. These neurons are the pain neurons or nociceptive neurons. So as you can see here in the diagram, you see a needle puncturing the skin. And the skin here is shown as a membrane, a cell membrane. What's going on is that it activates an energy response, and it opens up the gate that releases adenosine. And adenosine is known to either reduce pain or can stimulate pain levels. However, it depends on the type of receptor that a neuron has. It has been found that in acupuncture, more so than not, it's the activation of the A1 receptor that's actually creating decreased pain effects. So that's why people have pain relief. A lot more literature can definitely try to define these pain pathways. And as you can see here in a systematic review in 2019, with acupuncture needling, whether we're dealing with studies related to animal or human, there's a lot of different degrees of stimulation. And whether we're trying to decrease inflammatory biomarkers in the spinal cord, or we're trying to stimulate the endogenous neurotransmitters for feelings of pain relief, pain inhibitory neurons, those are all getting stimulated in the brain. And even in the gut, there's been some signs of different types of proteins and molecules that have been either positively influenced through acupuncture or negatively influenced by hopefully the inhibitory pathways. So moving on, these acupuncture points, they're very localized and they can be around superficial nerves. They're also possibly surrounded by blood vessels. And so it's very important to have a certified licensed acupuncturist to be needling your body, because one wrong move, you don't want to injure an important structure. But what you really need to know is that acupuncture needling helps to promote self-healing and homeostasis. This is the steady state of the body. And when you deal with healing the body, we have the potential with using acupuncture to influence the nervous system, the cardiovascular system, the endocrine system, which are your hormones, and even the immune system. So what is acupuncture? Acupuncture is the balance of qi and organ system functions. It's the nourishment of tissues. It's the free-flowing movement of qi, body fluids, and blood. And it's a way of correcting any imbalance or pattern that's in disharmony. And that's where a licensed acupuncturist is trained in. It's to figure out what your qi is and what your constitutional pattern is and where it is in disharmony. So what is qi? It is the life energy. It is your life force that circulates and animates us as human beings. It's the blood composition. It helps to move blood in the bodies. And remember, this is traditional Chinese medicine. It's an Eastern philosophy and theory. And I'll continue. Qi is also related to metabolism, how your vital organs are actually metabolizing and functioning. It's also related to the channels and meridians that are moving throughout your entire body from top to bottom and from side to side. It's also considered universal energy. There is a system related to the clock, and it has been part of the theory and philosophy of Chinese medicine that within every 2 hours, qi circulates within different organs. And sometimes we as acupuncturists utilize this clock in order to determine which organ is in disharmony. Say, for example, you have insomnia and you say to the practitioner, well, I wake up between the hours of 1 and 3 a.m. If you can see here, between 1 and 3 a.m., that's the liver time. So we would most likely ask a little bit more questions related to liver qi dysfunction, liver qi deficiency, or stagnation. The balance of yin and yang is related to organ function and also the ability of understanding your overall system approach. And the needles are directly impacting qi movement. Once a needle is puncturing the skin, we already ignite the qi response. And I say by we, it's you, the patient, experiencing the acupuncture. We, the acupuncturists, are only supplying the needles. In the basis of yin and yang theory, yin and yang is a miraculous theory because it relates to the idea that there are opposites. There is a yin and yang to every entity. They're interdependent of one another. They are part of one another. They can consume one another. They support or they transform each other. What does this mean? It can be related to the paired organs that we learn in Chinese medicine. For example, the stomach and the spleen. They're actually paired organs. When we deal with any pattern disharmony, we'll learn a little later that spleen and stomach is related to your digestion and all of the symptoms that can come about. The stomach is considered the yang, and so it has a lot of heat and warming and movement, while the spleen is considered the yin part, and it has cooling and nourishing and storing and manufacturing. And so knowing the different balance between the two and what pattern can come about when things are not in harmony, that's where we choose our acupuncture points, by listening to the body, to the person and their symptoms. So yin and yang is everywhere. It's our sun and it's our moon. It's our masculine, it's our feminine. It's something that's solid and it's versus something that's hollow. It's being an extrovert versus an introvert. So yin and yang theory presents itself in various ways, not only in our organs, but our personality, concepts, and objects in the world. When we correct any imbalance, we are always under the impression that to every entity, there should be an equal proportion of yin and yang. And you can see by this diagram and right in the middle. And any time that there's too much yin or too much yang, the body starts to present with symptoms. And this is where the acupuncturist has to figure out where the pattern is in disharmony. Is it yin deficiency? Is it yang in excess? And what kind of organ is related to that? Moving on, it's actually quite fascinating to identify a pattern disharmony. Anyone can actually do it. All you need is a tongue, stick out your tongue, and the pulsations of your radial artery. So obviously, you might need a little bit of practice and know what you're doing. But if you can see here in my diagram, there are 6 positions, 3 on each arm or wrist, and they relate to different organs. And so when an acupuncturist places their 3 fingers on your radial pulse, they're actually trying to determine the quality of your qi. Is it too deep? Is it too excess? Does it have a particular quality component? Is it wiry feeling? Does it roll under its fingertips, creating this sensation of a slippery pulse? This is all denotes a particular pattern that's in disharmony. And while looking at the tongue is like a map. If you can see the very tip, it's the heart, followed by the lungs. In the very center, it's your abdomen, kind of like the 3 cavities that you have along your torso. The liver and the gallbladder are the sides, and the very back is related to the kidneys, the bladder, and the intestines. So this is very helpful information as we're trying to parse through all the signs and symptoms to determine the pattern that's in disharmony. So if you have a thick coat, depends on where it's located, it could be a sign of some kind of disharmony in that location. Or if you have a really red tip on your tongue, you might have some heat in the heart, or maybe even some emotional distress. So as an acupuncturist, we ask many questions related to your overall body health. We ask the 10 questions: how you're sleeping, how you're pooping, how's your energy, how's your pain levels. We also are paying attention to the quality of your skin, or if you have any swelling, and also if you have any certain odor that's being exhibited from the body. We're also palpating. As we're trying to find the locations of all the points, we're palpating the meridians, because sometimes they can actually tell us whether something is significantly deficient, or if you actually feel pain, it could be full of excess. Now, acupuncture, as we know, has many different acupuncture points. There's over 400 points on the body. Yes, this is why it's a whole profession in memorizing, learning, and utilizing them. As you can see here in the diagram, this depicts various meridians, the 12 primary meridians that have points attached to them where we can actually needle. These are locations where the needle can be inserted to a varying limitation in measurement. There's also 8 extraordinary vessels that can be opened up or stimulated through the use of the 12 primary channel points. There's also other types of channels: cutaneous channels, which are really superficial; tendinomuscular, which involve the muscles and the tendons; the sinews are pretty much the connective tissue that surrounds muscles and all other structures; the luo-connecting, which are really great for drainage; collaterals; and divergence, which the divergence are even further and deeper types of channels. But usually when we are using acupuncture needling, we are accessing the 12 primary channels for the most part. In another theory called the 5-element theory, we utilize this to determine the person's constitution. So there are 5 elements: fire, earth, metal, water, and wood. And if you can see in this diagram, there are particular features about each element. And they're related to 2 organs. They're called paired organs. They work one together with the other. They're the yin and they're the yang. So if somebody presents with, let's say, red eyes, maybe a little teary, maybe, the wind is, they have some kind of ailments from every time they step outside and it gets windy, like maybe they get a cold, or maybe they have allergies. Maybe their allergies come along springtime, and maybe they have some like tendinomuscular issues and they're constantly have contractions in their tendons, or they feel really tight around their joints. And when you ask them about like how their emotions are and if there's any prominent emotion, they may say they feel pretty irritable and frustrated, to the point at its worst, angry. So if you can see here, I'm painting the picture of someone that has a liver gallbladder possible constitution. And the color is green. They might be wearing green that day. And they don't even know, but they're presenting already with their pattern. So all of these elements relate to paired organs, senses, external manifestations, the season, the flavor, the smell, the color. And as an acupuncturist, we're listening for all that, so that we can help to identify the constitutional body type and the organs in order to find the right pattern and acupuncture prescription to help balance the body. So, which constitutional pattern are you? These are just a list of questions, as you see in these boxes, that I tend to ask when I am considering someone might have a liver or gallbladder disharmony. And here are just some functions of what the liver does. It opens into the eyes and controls the tears. It stores blood for menstruation. It moves and smoothens the flow of qi. It manifests in the nails. It's very goal-oriented. Tasks, it governs energy, and it can also be related to any kind of tendons. When it comes to patterns that are in disharmony related to the heart or the small intestine, There are many questions that we ask related to the heart, actually. Heart palpitations, chest pain, how's your blood pressure? Do you have any issues with sleep? Are you startled easily? What's your complexion? What's your flavor of choice? Do you have anxiety? The reason why is because the heart functions control the blood circulation. They open into the tongue and they affect your speech. They can manifest on the face. The heart is known to house the mind and the mental activity, memory, and sleep. Sometimes people will report, I have insomnia, poor memory, and a lot of anxiety or mental chatter. Sometimes it's related to heart qi deficiency. It also is in charge of happiness and joy. Unlike the liver, which was related to frustration and agitation and anger, the heart is related to joy, maybe even overjoy, to mania. That's when the pattern is in disharmony. It also controls sweat. Someone with excess sweat, we ask questions related to heart. When it comes to the digestive organs, we think about the spleen and the stomach. Lots of questions to ask about digestion. How's your breath? Do you have any bad breath? Do you have any cravings of sugar? How's your energy levels? The spleen is controlling the muscles. So sometimes people will feel weakness or tired muscles. It governs our digestion. It's related to the transformation of our nutrients into usable energy. It can control our saliva. It can hopefully prevent from water retention. It produces blood. It can also help to strengthen our organs and prevent prolapse. It can manifest on the lips because it opens into the tongue, and it controls clear thinking. Another type of pattern that is commonly in disharmony is related to the paired organs of the lung and large intestine. We ask many questions related to lung. Do you have a cough? How's your upper respiratory tract? Do you have any sinus pain, any nasal discharge, shortness of breath? But because it manifests also on the skin and body hair, maybe some people will experience a skin rash or hives. The lung also controls the defensive qi and is related to the immune system. Sometimes with lung qi disharmony, individuals may have a propensity for catching colds and flus. It can control qi, which is energy, and respiration. It regulates water metabolism. And it's interesting, it opens the nose, but it controls qi in all meridians. Lastly, the paired organs of the kidney and the urinary bladder are related to functions of the kidney and urinary bladder, but also it can depict some signs of thyroid issues or adrenal fatigue, poor memory, hair loss, dark circles under the eyes, low or excessive sex drive, cold extremities, osteoporosis, feelings of cold, weakness of the knees, weakness of the back. It can also be related to ringing in the ears. It opens into the ears. It controls the lower orifices. It governs water. It receives lung qi. In certain disharmonies related to asthma, it's actually really important to balance lung and kidney qi. It also houses willpower. It produces bone marrow and controls the bones. It's also part of fertility treatments because it stores essence. And so as you can see here, there are a lot of variety of different patterns, constitutional body types. And so when we think about treating the individual, everybody presents a little bit different. And so figuring out all those specifics can be really helpful when using acupuncture to treat what ails you. Thank you so much for your time. And I wish you a very good day. And if you'd like to try acupuncture, please be free and book your online appointment at the Mandel JCC website. You'll follow it with fitness and wellness, holistic health options, and there's a link below. And I wish you a very, very good day. Have a good one.